If you are a Canadian senior and a hospital bill has recently arrived at your home, do not panic and do not assume that every dollar on that bill is automatically something you have to pay. At the same time, do not make the opposite mistake of believing that every hospital related charge in Canada is automatically free. The difference between these two situations can save you money and can also prevent a lot of unnecessary stress. Canada's healthcare system covers medically necessary hospital services for eligible residents, but there are also services and expenses that may not be covered by your provincial health plan. And when you are recovering from an illness, surgery, emergency visit, or hospital stay, the last thing you want is to receive an invoice and have no idea what it actually means. That is why today I want to walk you through what Canadian seniors should check before paying a hospital related bill, what questions to ask, what charges deserve a closer look, and what you should do if you believe you have been charged for something that should have been covered. Because the biggest mistake is not receiving a bill. The biggest mistake is paying it without first understanding what you are being charged for. The first thing you need to understand is that medically necessary hospital care is generally covered under Canada's publicly funded healthcare system for eligible residents. That can include medically necessary treatment provided in a hospital, nursing services, diagnostic procedures, and standard accommodation in a public ward. So if you receive a bill after a hospital stay, you should not automatically assume that the entire hospital treatment itself is being billed to you like a private medical bill. There may be a completely different reason for the amount shown on the invoice. It could relate to an uninsured service, a preferred room, transportation, equipment, administrative services, or another item that falls outside the publicly insured services provided by your province or territory. This is why the first question you should ask is very simple. What exactly am I being charged for? Do not be embarrassed to ask. Do not feel that you are wasting anyone's time. If the bill says a large amount, but does not clearly explain what created that amount, contact the hospital billing department and ask for an itemized explanation. You want to know the date of the service, the name of the service, the amount charged, and why the hospital believes that charge is your responsibility. Imagine that you were admitted to hospital after an emergency. You stayed for several days, received treatment, had tests, and were eventually discharged. A few weeks later, you receive an invoice. The first reaction for many seniors is fear. They see a number on the page and immediately think, I have to pay this. But before reaching for your credit card, look carefully at the description. Is it for standard hospital accommodation? Is it for a private or semi-private room? Is it for television or telephone service? Is it for an ambulance? Is it for a medical form or certificate? Is it for a service that was not medically necessary? Or is there a possibility that the charge has been applied incorrectly? These questions matter because not every hospital-related expense falls under the same rules. And there is another reason seniors need to pay attention. When you are in an emergency situation, you may not remember everything that happened during admission. A family member may have completed paperwork for you. Someone may have selected a room preference. Someone may have agreed to an optional service because they were focused on getting you treatment as quickly as possible. Weeks later, when the invoice arrives, you may not even remember agreeing to anything. That is why keeping your hospital paperwork is so important. Keep your admission documents, discharge papers, receipts, insurance information, and any forms you signed. If you receive a bill later, you can compare the charge with the documents you already have. Now let's talk about one of the most common areas of confusion: hospital rooms. In Canada, standard hospital accommodation is generally part of insured hospital services for eligible residents, but a private or semi-private room may involve an additional charge depending on the province, the hospital, your circumstances, and whether you have private insurance. If you requested a private room, check whether your private health insurance covers that expense. If you never requested one and still received a room-related charge, ask the hospital to explain exactly why the charge was added. Do not simply assume that the invoice is correct, but also do not assume that it is automatically wrong. Get the explanation first. The same principle applies to television and telephone services. These may seem like small expenses, but when you are staying in hospital for several days, small daily charges can add up. If you see these items on your invoice, check what they are, how many days you were charged, and whether you actually used or requested the service. Another area seniors should pay attention to is ambulance transportation. Many Canadians assume that because the ambulance takes them to a hospital, the entire service must automatically be free. That is not necessarily how provincial coverage works. Ambulance coverage and patient charges can vary depending on the province, the circumstances, and the patient's eligibility. So if you receive an ambulance bill, do not treat it exactly like a hospital treatment bill. Check the rules that apply in your province and find out whether you qualify for coverage or reduced charges. This becomes especially important for seniors who may have limited income and may already be managing prescription costs, housing expenses, utilities, and other retirement expenses. A charge that looks manageable on paper can become a real financial burden when you are living on a fixed monthly income. Now, here is something else that many seniors do not realize. Your hospital stay and your prescription medication after you leave the hospital are not necessarily treated the same way. Medication administered as part of insured hospital treatment can be covered, while prescriptions you take home after discharge may fall under your provincial drug program, private insurance, or your own out-of-pocket costs. This is why you should not look at a pharmacy bill after a hospital stay and automatically assume that the hospital was supposed to cover it. Instead, check whether you qualify for your province's senior drug coverage, whether you have private insurance, and whether the medication is included under your particular plan. If you are a senior in Ontario, for example, the Ontario Drug Benefit Program has specific rules for people aged 65 and older. Other provinces have their own programs and eligibility requirements. The details are different across Canada, so always check the rules where you live. Now let's talk about something even more important. What happens if you believe you were charged for a medically necessary insured hospital service? If you look at the bill and the hospital tells you that you owe money for something you believe should be covered, do not simply ignore it. Contact the hospital and ask them to explain the charge. If you still believe the charge is incorrect, contact your provincial or territorial health authority or health ministry and ask what complaint or review process is available. Keep copies of everything. Keep the original invoice, keep receipts, keep emails, write down the date you called, the name or department of the person you spoke with, and what they told you. This may sound like a lot of work, but if there is a disagreement about a charge, having a clear record can make the process much easier. And seniors should be especially careful about one thing. Never give your personal banking information to a person who unexpectedly calls claiming to be from the hospital and demanding immediate payment. Healthcare-related scams can become more convincing when someone has recently been in hospital. A scammer may know that seniors are worried about medical expenses and may try to create urgency by saying that your account will be sent to collections unless you pay immediately. If you receive a suspicious call, do not give out your credit card number, banking password, security code, or other sensitive information. Instead, independently find the hospital's official contact information and call the billing department yourself. The same rule applies to emails and text messages. Do not click an unexpected payment link simply because the message looks official. Verify it first. Now, there is another mistake that can cost seniors money: failing to check whether private insurance should be paying a charge. Some seniors have extended health benefits through a former employer, a spouse's plan, a retiree benefits package, or another private policy. If you have insurance, do not assume the hospital automatically knows what your plan covers. Ask the billing department for the information your insurer needs and contact your insurer directly to confirm whether the charge is eligible. Sometimes the difference between a large out-of-pocket expense and a much smaller expense is simply knowing which organization is responsible for the charge. And if you are married or living with a partner, it can be helpful to keep both people aware of your insurance information. You do not want one person to be in hospital while the other person has no idea where the insurance documents are or what coverage exists. Now, let's talk about another situation that seniors often face: rehabilitation, home care, or services after leaving the hospital. Being discharged from hospital does not mean every service you receive afterward is automatically covered in the same way. Home care, rehabilitation, medical equipment, transportation, and other services can have different provincial rules and eligibility requirements. If a service is recommended during your discharge planning, ask what portion is covered and whether you need to apply for a provincial program. Do not wait until you receive a large invoice to start asking questions. Ask before the service begins whenever possible. This is particularly important if you need equipment such as mobility aids, specialized medical devices, or home modifications. There may be provincial programs, community programs, charitable programs, insurance benefits, or tax measures that can help with some costs depending on your circumstances. Another important point is that turning 65 does not create a magical rule where every healthcare expense becomes free. This is a misconception that can lead seniors into trouble. Becoming a senior can make you eligible for certain provincial programs and benefits, but each program has its own rules. Some are based on age, some are based on income, some depend on medical eligibility, some require an application, some may be automatic, and some services remain outside public coverage. So instead of asking, "I'm over 65, why am I being charged?" ask a more useful question. Which part of this service is insured? Which part is uninsured? And what program or insurance could apply to the remaining amount? That question gets you much closer to the answer. Now, I want you to imagine that you have received a $600 hospital-related invoice. You do not know why. You could pay it immediately and move on. Or you could spend 10 minutes contacting the billing department and asking for an itemized explanation. You discover that $450 relates to an optional accommodation charge that may be covered by your private insurance, while the remaining amount relates to another service. You have now avoided making a decision based on incomplete information. Maybe the bill is correct. Maybe insurance covers part of it. Maybe the hospital made an administrative error. You cannot know until you check. That is the entire point. Checking first does not mean refusing to pay legitimate bills. It means making sure you understand what you are paying for. And if the bill is legitimate, ask whether the hospital offers a payment arrangement if you cannot afford the full amount at once. Seniors should not be afraid to ask about payment options. A financial problem becomes much worse when someone ignores an invoice because they are embarrassed to say they cannot pay it. Contact the billing department, explain your situation, and ask what options are available. Now, let's put everything into a simple mental checklist. If a hospital-related bill arrives, stop and read the description. Check your name and patient information. Look for the exact service that created the charge. Ask for an itemized statement if the invoice is unclear. Determine whether the service is medically necessary and publicly insured, or whether it is an uninsured or optional service. Check your provincial rules, check your private insurance. Contact the hospital billing office if anything looks unclear. And if you believe an insured service has been improperly charged, contact your provincial health authority for guidance. Keep every document and record every conversation. And above all, do not allow fear to make the decision for you. A hospital bill can look intimidating, especially when you are already dealing with health problems or helping an elderly parent recover. But the number printed on the invoice is not the end of the conversation. It is the beginning of your opportunity to understand exactly what happened. Canadian seniors have spent decades contributing to this country and to the public systems that support Canadians. Knowing how those systems work is one of the best ways to protect your retirement budget. Healthcare costs can be confusing because Canada does not have one single rule that covers every expense in exactly the same way. Provinces and territories administer their own health plans, and the details can vary. That is why you should always verify the exact rule for your province before making a financial decision. But the basic lesson remains simple. If you receive a hospital-related bill, do not blindly pay it and do not blindly ignore it. Understand it. Question unclear charges. Check your coverage. Ask for help when necessary. And keep your records. If you are a Canadian senior who recently received a hospital, ambulance, room, medical equipment, or other healthcare related bill, take a few minutes today to look at exactly what you were charged for. You may discover that everything is correct. You may discover that insurance applies. You may discover that you need to contact your provincial health authority. The important thing is that you will be making the decision with information instead of fear. And if you know a senior who has recently been in hospital, send this video to them or to a family member who helps manage their paperwork. Sometimes the most valuable financial advice is not about making more money. It is about preventing unnecessary money from leaving your account. Stay informed, check the details, and never make an important healthcare payment decision simply because an invoice tells you to.